Today I'm making a policy announcement that also aligns with one of our 100-day commitments. The Coalition Agreement will increase free breast cancer screening for New Zealand women for ages 70 to 74. This will introduce another 60,000 New Zealand women per year to the free breast cancer screening program and better align us with international settings. The extension could potentially save 65 lives per year. However, translating our current uptake, this relates to 22 lives saved, meaning we need to do more to increase the uptake. The implementation timeframe is within the current parliamentary term. However, the Coalition Government has ambitions to commence as soon as possible. Implementation timing is dependent on features such as human resources and capital resources for items such as mobile screening units. I want to thank the dedicated clinical leaders and management and the Breast Cancer Foundation for their endeavours that bring us to this very important policy announcement here today. With that, I'd like to pass to my colleague, the Honourable Louise Ustom, Acting Minister for Women.
Thanks, Shane. This is a fantastic win for women by adjusting the breast screening age to include thousands more women. We are showing women that they are a priority of our government. As Acting Minister for Women, I'm incredibly supportive and excited by the progress that we are making for women affected by breast cancer. As we know, too many women are affected by breast cancer, whether directly or indirectly, and it has a significant impact on their families too, as I know from personal experience. We know that early detection of breast cancer is crucial for women to receive treatment and, importantly, to have a better prospect of survival and recovery. That is why this commitment we have made is so important. I want to acknowledge the work of charities like the Breast Cancer Foundation for their advocacy and work over many, many years in this space. This coalition government prioritises women and is determined to achieve tangible outcomes, especially in health. I also want to thank my friend and colleague, the Honourable Dr Shane Reti, for his work. And I look forward to continuing to work with our coalition partners to progress women's health progress.
Thank you, Louise. So just to reiterate and to conclude, the policy statement that the Coalition Government is making today is that we will increase free breast cancer screening for New Zealand women for the ages of 70 to 74, and we are very excited and ambitious to commence this as soon as possible.
The biggest challenge is staff, and so we need about 50 clinical staff recruited, and it's a number of radiologists, what are called radiographers in the old language, but MITs, and a number of other support staff as well, to ensure that we have that capacity to deliver, as well as some further equipment, expansion of some facilities. So all of that takes some time. And in the meantime, of course, we're still going to continue to work on raising our rates of screening across the board, and particularly for high-need communities and high-need populations. Yes, so there's still planning to go, but we're likely to be bringing it in age groups rather than all at once, and I think that's to enable us to make sure that we are delivering and meeting the needs of those 60,000 women a year, so it would probably be staged over a period of time. So we first of all need to get Cabinet approval and a budget for this, and then once we have, we can start to recruit, so that there's a delay of a little period, but it's likely to take up to 18 months to successfully recruit all of those staff. We haven't got into the detail regarding surgical staff, but there will need to be some increase in surgical output for a period after the program starts. So that's all factored into our modelling. There will be some downstream costs because thankfully a lot more breast cancers will be detected, and that will require additional, particularly initially, additional surgeries and obviously additional surgeons, nurses and support staff. Longer term, of course, you're getting cancers detected at an earlier stage, less complicated and less surgery, but initially there is certainly an increase required.
Thanks for checking out our YouTube channel. To stay up to date with all the latest news from the New Zealand Herald, click the subscribe button below or check out one of the videos here, and head over to nzherald.co.nz for more details on these stories and more.